Hi, in this video, I'm going to be talking about different people you might see on your medical team. Before I do that though, I'd love to invite you to subscribe to our YouTube channel. You can also go to Yerbba.com to learn more about your treatment options you may be hearing about as you move forward through your treatment. So there are all kinds of people you'll see. If you've had surgery, if you've been seen in a doctor's office, you know that there are many people in addition to the main doctor that you consider your physician that you'll see. So I thought I'd go through different people that you might see and explain their background and what they do. First of all, it's really important to know that everybody on your team is committed to taking the best care of you. If you are being treated at a place where there's a training program, whether that's a residency training program or a fellowship training program, you will see other people, other physicians who will work with your attending physician to help take care of you. Even before that, though, there are medical students. You may see medical students. These are people who have a college degree. This is in the US. We go to college first and then we go to medical school. In other parts of the world, it's one school. You basically do undergrad and medical school. They're all one thing. You specifically go to school to be a physician. So I was an English and biology major, and then I went to medical school, but my friends in England went straight into medical school. So medical students are learners. Obviously, they do not have a medical degree. They have a college degree. They are really smart. They've just finished medical school. The learning that they're doing now is like an apprenticeship. So they're following other doctors around and learning how to be a physician. Then at the end of medical school, usually you'll be seeing people in their third or fourth year out of 4 years of medical school. After that, they go on to do a residency. So medical students usually take care of only a few patients. They have lots of time to spend with you, deeply empathetic, and they're really good at taking histories. They collect every little detail. After medical school, we do a residency. So who are residents? Residencies go from 3 years to 6 years. So a resident is somebody who already has a medical degree, and after their first year of residency, they have a license, but they can't practice independently. They're training. And depending on what they want to do ultimately will determine what residency they do. So if one wants to be a medical oncologist like me, I did an internal medicine residency and then a fellowship in oncology. A surgeon does a surgical residency. They may also do additional training specific to cancer care or breast cancer care. Radiation oncologists do a 4-year residency, and then they may also do additional training called a fellowship. Residents report to an attending physician, and there's actually a hierarchy even in residency. So first-year residents are sometimes called interns. Again, these are physicians who do a lot of hands-on care. Interns sometimes know you better than anybody else because they're checking your labs. When I was in training, we even drew the blood of our patients. They know a lot about you, and then they will report to a senior resident, either a second or third or fourth year or higher resident, and then that resident reports to the attending physician. If you're at a place where there aren't residents, you will be cared for by an attending and then often by an advanced practice provider, like a nurse practitioner or physician assistant. And I'll get to that more in just a moment. So residencies last 3 to 6, sometimes a little longer. And these are physicians doing training so that they can become the kind of doctor they want. A fellowship is additional training after residency. You can't do a fellowship without doing a residency. Fellows basically are practicing the field that they want to go into. So when I was an hematology oncology fellow, I considered myself a hematologist oncologist. I was still in training, but that was what I'd wanted to be my whole medical career. And now I was doing that work. I wasn't doing unrelated rotations. So we rotate for, sometimes 3 months, sometimes a couple weeks. So we get to see a wide variety of patients. Surgery fellowships are often to specialize, like I mentioned before, in cancer care or sometimes in breast cancer care specifically. Sometimes we do research fellowships as well, and we can still be seeing patients while we're doing a research fellowship. We know the most we know about our field at the end of fellowship. We've seen a lot of patients, a lot of different types of patients, and then we might choose to focus on one area, or we may stay more general. So in a teaching hospital, you will find that fellows and oncologists tend to specialize in 1 or 2 diseases. In community settings, which is where most people get their care, about 95% of people get their care in community settings, most oncologists or surgeons will be a little bit broader, but they still may focus in a larger practice on 1 or 2 cancers, but they are really adept at taking care of people with any kind of cancer. When you're an outpatient, you will most often see your main oncologist and their learners, their students, residents, or fellows. If you're in the hospital, you might have a different attending because we often take turns being on service in the hospital. It's very disruptive. It's hard to see people in the office and in the hospital. So you may see a different medical team. Ideally, they will communicate with your main oncology team. If you're first diagnosed in the hospital, the doctor that sees you, as long as they're comfortable treating people with breast cancer, may become your long-term oncologist. If you like your doctor that you're seeing in the hospital, you can ask if they can be your long-term oncologist. If they don't specialize in breast cancer, let's say they specialize in pancreas cancer, they will recommend somebody for you on their team or in their practice. Next, I'm going to talk about nurse practitioners and then physician assistants. Not for any particular reason, but nurse practitioners are nurses. They've usually done complete nurse training and then decided to become nurse practitioners. Nurse practitioners can practice independently. They do not have to report to a physician, but what you will find in cancer care is that they do. So a nurse practitioner is an equal partner to the physician. The nursing model means that they're very good at managing symptoms, managing psychosocial stress, anxiety, having those really important conversations with you that sometimes the physician may not have. Some of your visits you will see the nurse practitioner and the attending, and other visits you can just see the nurse practitioner yourself on their own with you, and that can let you get to treatment and get on to the rest of your day. Note that the nurse practitioner will usually share any important information with the attending physician. So everybody talks to each other, and you can ask, will you share this with Dr. So-and-so? And they will do that. Now, the other kind of advanced practice provider is a physician assistant. Physician assistants work under the direction of a physician, but they can do procedures. So they can do things like bone marrow biopsies, they can do aspirations if there's a collection of fluid in the breast. They can, with the attending, write chemotherapy orders, just like nurse practitioners, but the orders are co-signed in general by an oncology attending. That may be different in different practices. If you're in a remote rural area, those orders can be signed ahead of time, and in some states, physician assistants and nurse practitioners can actually write the orders themselves without a co-sign from the attending. Note, though, that the original treatment plan is designed by a physician, and really we work hand in glove with our colleagues who are NPs, nurse practitioners, and physician assistants. And they really are independent thinkers. They will take very good care of you. They make house calls sometimes. I hope this has been helpful in explaining all the different kinds of people that you'll see. Some people tell me they're much closer to their resident or fellow or the nurse practitioner or physician assistant than they are to the attending, and that's perfectly fine. That's actually great because it just increases the number of people on your team. If this has been helpful, click like. That helps other people just like you find this video, and of course subscribe. We put out 3 videos a week that will help those videos pop up for you. And drop your comments or questions below. I get back to you within a week or 2 at the most to answer any comments. Let us know your experiences. You know, who do you feel closer to? And share that information with the Yerbba community. Thank you so much for watching.